Hi, my name is Ritu Saxena. I'm a cardiologist at the Minneapolis Heart Institute, speaking with you today on behalf of the Nolan Family Center for Cardiovascular Health and the Penny Anderson Women's Cardiovascular Center from the Minneapolis Heart Institute Foundation. I'm here to talk to you today about heart disease risk factors that are unique to women, as well as strategies that you can use to reduce your risk. Many women believe breast cancer is their greatest health threat, but cardiovascular disease, or CVD for short, is the leading cause of death in women, more so than all types of cancer combined. Nearly 8 times as many women will die from cardiovascular disease compared to breast cancer. At this moment, about 44% of the women in the United States are living with some form of heart disease, and nearly half of the women under the age of 45 have at least one major risk factor, such as diabetes, high blood pressure, or hyperlipidemia, otherwise known as elevated lipids. Just a few decades ago, heart disease was considered a man's disease. But today, we know better. Women still experience traditional risk factors like high blood pressure, high cholesterol, or elevated glucose. But there are some risk factors that are unique to women and that can start as early as our 20s and increase our cumulative risk over a lifetime. So let's go over some of these unique risk factors. Pregnancy is often described as an early life cardiovascular stress test due to the significant demands it places on the heart and blood vessels. Complications such as gestational high blood pressure, preeclampsia, gestational diabetes, or delivering a premature or low birth weight baby increase long-term cardiovascular risk. While these risks were once thought to resolve after delivery, evidence now shows that they can persist well beyond pregnancy. Approximately 10 to 15% of women experience one or more of these complications during their pregnancies. Those affected should work with their healthcare provider to ensure ongoing management of their blood pressure, blood sugar, and other risk factors such as cholesterol. A woman's midlife at the start of perimenopause and through menopause is associated with potential changes in cardiovascular health. Menopause is defined as 12 months since your last menstrual period. If menopause occurs before the age of 45, this is known as early menopause. It increases the risk of heart disease by 4 to 5 times. Following menopause, the absence of estrogen's protective effect leads to a rapid increase in cardiovascular risk for women, reaching levels comparable or sometimes even exceeding those observed in men. Many women may experience higher cholesterol, high blood pressure levels for the first time in their life. Additionally, symptoms such as hot flashes, mood changes, reduced lean muscle mass, sleep alteration, and increased visceral fat surrounding the organs may occur, all of which contribute to heightened cardiovascular risk. Hormone replacement therapy, or HRT, can ease menopausal symptoms for some women and may lower cardiovascular risk when started in the right woman at the right time, typically between ages 50 to 59. Decisions about HRT should be personalized, considering your health history and other risks, as well as your preferences. Talk with your healthcare provider about whether HRT and which route of HRT is appropriate for you. Finally, the last set of risks related to women include autoimmune diseases such as rheumatoid arthritis and lupus, as well as things like polycystic ovary syndrome, or PCOS, which is both an endocrine and metabolic disorder. All of these conditions are more common in women and linked to increased cardiovascular disease. One of the best actions you can take for your health is to know your numbers. This includes blood pressures with optimal level, less than 120 over 80 millimeters of mercury, blood sugar less than 100, and an LDL or bad cholesterol of less than 100. For some women, asking for additional tests with their cholesterol panel may be helpful. Several tests have recently been linked to enhanced cardiovascular disease risk detection in women. These include lipoprotein(a), which is a genetically determined lipoprotein that promotes clotting and plaque formation. This should be measured at least once in your lifetime. Highly sensitive C-reactive protein, otherwise known as hsCRP, is a marker of inflammation in your system, and ApoB, or apolipoprotein B, a specific measure of plaque. Discuss with your provider if they could refine your risk assessment using these tools. Once you know your risk, there are steps you can take to lower it. Life's Essential 8 is a set of lifestyle behaviors you can engage in to significantly reduce your cardiovascular disease risk. These include refraining from using tobacco, getting enough good quality sleep, at least 7 to 9 hours each night, focusing on eating a variety of whole foods, including plenty of vegetables and fruits, whole grains, and heart-healthy fats, getting enough physical activity, at least 30 minutes of moderate aerobic activity most days, managing blood glucose, as diabetes significantly increases risk of cardiovascular disease, even more so than in men, engaging in weight management behaviors, and finally, knowing your cholesterol and blood pressure levels and if they're within target range. Additionally, blood pressure, cholesterol, and blood sugars are all significantly impacted by our genetics. So don't be afraid to take a preventive medication if needed to help counter what you have inherited. Unfortunately, cardiovascular disease in women is under-recognized, underdiagnosed, undertreated, and underrepresented in research. That's why education and awareness really matter. At the end of the day, you are your own best advocate. Trust your instincts. If something doesn't feel right, get help and share your concerns with your health provider. I hope you found this video helpful. At the Minneapolis Heart Institute Foundation, education is a core part of our mission. I encourage you to share this video widely with your family, friends, social network, and really anyone you think would benefit from this. Have a great day and stay heart healthy.